Bowhead Futures presents Digital Health at the Front Lines. We explore how healthcare is shifting by deep diving with the doctors transforming the system from the inside out.
We're learning that there's so many different ways in which you could implement technology, right? You can use it for an organizational management and data perspective. Then there's ways to use technology that are more so engaging with the patient, the remote patient monitoring, also using technology to allow patients to track certain health behaviors during clinical trials at home. There's just so many different ways, obviously wearables, devices. So yeah, I'm curious what your thoughts are of digital transformation in general, and where you see this space having the most impact and also adoption.
It's a great question, and that's a huge question, because I think this is the future. I think digital tools and digital technologies are the future of what we're doing. I think the problem right now is we're so nascent in the technologies that we're awash in data, and we don't know how to use it all. And everything that you just asked about, all these different aspects of this digital transformation it's all over the place. So how do we put it all together? One of the good and bad things about the way we do things is we have an electronic medical record, and so much is done through these systems. And so a lot of what we talk about with digital tools and technologies are trying to figure out ways that they can integrate with our electronic health record. And I think it's good that you have some central repository, but it's bad also because everything goes through this one system. And so you need all of your IT resources to be able to integrate with this one system. So how do you take all of this data that's coming from the patient, that's coming from me as the providers, and how do you use it?
Yeah, and I guess when patients leave the clinic and want to go somewhere else, they probably can't take the data with them, right?
Right. Yeah, that's a good point. The data is really tough to get, and there are abilities for a lot of these systems to talk to each other, and that is a really great change we've seen over the last several years. Is that I'm able to access the medical records of other systems to make it a lot easier rather than doing faxes of medical records, or a patient coming in with a big stack of their records, which is just not a good use of the technologies that we have available. And I think, really that's hopefully in some way some of the promise of machine learning and artificial intelligence is this idea of that, look, you don't need to necessarily understand all of it, but if you can have other abilities to analyze it and be able to give us information, and whether that's real-time information of a patient comes in and says they're saying certain things, and I have data on what their lab tests are like, that'll help direct me in some way to what the diagnosis may be. Or it could help direct me to say, okay, look, this is what I would recommend for you for ways that you can live a healthier lifestyle.
Yeah.
So I think these are all various ways that we've tried to, leverage these digital tools to try and integrate them, in our system.